Hi, good evening, everyone. Thank you for joining me. I'm Dr. Philip Macmillan. I've been following COVID since 2020, looking at autoimmune responses. Now, the recent news that interestingly you may not have heard about with regards to Anthony Fauci's diary, that Rand Paul, the senator in the US, who had been looking through this, he released the diaries from he was writing from 2020, early 2020, all the way through the pandemic, and he also released a Ralph Barrick interview. So they are probing very carefully to understand what happened in the pandemic. But what is fascinating is that this story has not touched the mainstream news. One of the most significant pieces of information throughout the pandemic, no one is talking about it. I did just a check on BBC to see if they said anything, and nothing. So, without further ado, the person who I usually come to as a balanced perspective and insight is Dr. Shankara Chetty. Shankara, how are you?
Fine, thank you, Philip. Thank you for having me again.
Excellent. So, listen, we are taking on this topic here. What were your thoughts initially when you heard about these diaries being released? Because this is only in the past few days. What were you thinking?
Philip, I think it validates a lot of my initial understanding of what was going on with the pandemic, understanding that this is probably a lab leaked virus that was manipulated. And I think that dictated every single thing that transpired from that point on. I mean, the starting point of the virus is absolutely instrumental in dictating where we went with the pandemic. So if we got the initial understanding wrong, that will cascade into a whole lot of a litany of bad decisions, and we've seen that with the pandemic. So I think
Yeah,
very
I think
important to
that what just to give the audience context, what we've got is a very large document, 1,141 pages. And this is what it looks like. It was released by Chairman Rand Paul, Senator, and in it, it has the fact that during his time as NIAID director, particularly during the COVID pandemic, Anthony Fauci took meticulous notes about his work, conversations, decisions, thoughts about politicians and other officials. So don't ask me how they managed to get this as a document. And that in itself is quite fascinating because it seems as though because it's work related and personal, they were allowed to take this information and look at it. And then after they had reviewed it, Rand Paul took the decision to just put it out there publicly. Now, this is not a leak per se, meaning that it's not illegal what he has done. It's just surprising. They don't normally do this. But he has put the 1,141 pages of information, and just so that you have a context as to what it is that is here, when you look at it here, we're talking about emails, comments, all kinds of things that he shared during this time. So it's a huge treasure trove of information that we will be able to go through gradually over time to try and understand what is going on. So, I mean, truthfully, Shankara, in terms of your case, I can't think of anything better that could have happened for you.
Well, Philip, my case has been now pending for the past 3.5 years. And of course, when the case was brought up, we had this information. We knew what was going on. When we talk of EcoHealth Alliance, the ex-vice president of EcoHealth Alliance, Andrew Huff, made contact with me early on to say he'd like to testify and spill the beans as to what EcoHealth Alliance was doing. He left because of the nefarious agenda. There are a lot of bits and pieces that came out through my journey with COVID, Philip, talking to people from the CIA, Department of Defense, little bits and pieces that came together and informing my understanding of where we went with COVID. And of course, it's been a fight for the past 4 years to awaken humanity to the threat that we face. I did mention that we have more deaths from the vaccines than we have with all the wars fought in the last 6 years. So biologic warfare has that discriminate, discrete, uh, and we never noticed it. So we've probably been through the Third World War already from the death toll, but it was a very discrete, discriminate war. And now finding that Fauci has had an influence in this and been integrally involved in it, uh, I'm sure there's a group of people that need to be held to account. If it was an engineered virus, if it was a planned pandemic, we know about Event 201. We know about all the different things that transpired that fell into place. We know about the science that was corrupted, people censored. There was a lot of information censored, Philip, and the information censored was scientific truth. And I think the censorship was about towing a narrative. Anything that went beyond that narrative was censored. Uh, a simple thing like the transmission of the virus, the Chinese found a positive PCR rectal swab and that was hidden. Was it because a mask won't make sense if we found a fecal-oral route because we identified it in sewage? So did we not mention the fecal-oral route because we didn't want to muddy the game plan to isolate people and to force them into wearing masks? And it
I,
was
I,
illogical,
I
absolutely
want to
illogical.
pause you on that there, Shankara. You said that the fecal oral testing was suppressed early on,
Yeah.
because that is exceptionally significant, because the more that I'm looking at this virus, I'm calling it an intestinal virus with respiratory complications.
Yeah.
And if that was being covered, it means that there was a knowledge that it was doing this kind of damage, and potentially with the intention to make it do more damage. That is frightening to conceive.
I think, Philip, the aim was to bring down lockdowns and masking and isolation of people. To do that, you needed to have a public health narrative that fitted that profile, allowed you the latitude to do that. Now, if we found a coronavirus that can spread through a respiratory route and a fecal-oral route, and it has other reservoirs of hosts in other species, then there was no point isolating or locking down anyone. It would have had to play out the way it played out. I mean, Philip, we're trying to isolate a respiratory virus. Anyone that's passed wind knows the limitations of a cloth mask and what it can and can't do. So, with what happened, there was a lot of illogic in it. But to sow that illogic, they had to limit the narrative. Whenever it got away from them, they had to censor. So, if we knew a fecal-oral route, it would have helped us solve a lot of the problems we had with the pandemic. And looking in different areas, we had to find Carlo Brogna eventually to come and help us with that. But for someone of Fauci's intellect and understanding to not uh, take further a positive PCR rectal swab, and then a year later to find it isolated in sewage and still not look at a fecal-oral route, uh, for a person of his caliber, I wouldn't like to think that it was silly of him. I think it was an agenda that he was following.
Now, I want to take us, because for the audience who is watching, this is, we're not going to spend a lot of time on this, but I want to show you some of the points with regards to what has come out. So I've captured this section here. This is January 31st, 2020. And this is him documenting a truly amazing day. He was in the White House working on a proposal to put in front of the president that would restrict travel from China. And as he's documenting it, he's talking about a Chinese woman who came from Shanghai to Germany and got sick, and infected Germans. So he was talking about the fact that it was going to spread, present it to POTUS before the stock market closed so that we do not look like we held it off to avoid bad effects. All of that is going on. Now, this is the bit that stands out. So this was the 31st of January. And he says that one theory was written by Indian investigators about HIV sequences, which didn't quite pick up. Everyone thinks that is crazy. But the Farah phone call was different. The people on the phone felt that the mutations around the furin cleavage site of the spike protein could not have occurred naturally since it would require an evolutionary jump that they found nowhere in bat isolates. This is exactly what we had been talking about, Shankara. And the question is, this was on the 31st of January. And what is fascinating is that by the end of February, okay, now wait, I'm going to show you something else, because after he had that call, he then had on the Today Show, this is the 1st of February now, conference call with a number of other scientists at 2 p.m. And you can see the list of all the scientists here across the US, Germany, and so on. And then he said, now, there was not total agreement about the likelihood of deliberate insertion of the furin cleavage site. Ron Fauci said he was sure this could occur naturally, and we should not waste our time and divert effort to pursue this. And he then goes on, this was expected of him since he was the original gain of function person with Yoshi and Kawakoka. Now, this is very strongly indicating that at that time, Fauci didn't think this was natural. Yet within a month, we had the paper produced about the proximal origin of the virus being natural. How do you explain that, Shankar?
I don't think you can, Philip. They were discussing the furin cleavage site. Fauci is, I think, in the field of genetics, is very competent. We got people that were involved in gain of function research talking about the furin cleavage site. And now they find a virus that has a furin cleavage site on the spike protein, which doesn't occur in any other SARS coronaviruses. A very unique feature of this virus is the furin cleavage site on its spike protein. And for you to have such a broad mutation will require, like they said, a huge mutational leap. So that shows it can't occur naturally. That was exactly where this came from. But for Fauci to turn around and then publish the Proximal's origin paper, it showed that they were hiding something, that they were not considerate of all the facts in front of them. And they were cherry picking the facts that fitted their future narrative or the direction they would like to steer the public in. And so a lot got hidden, a lot got manipulated. And of course, a lot of these public health experts never saw COVID patients. And of course, they all self-proclaimed. There was no expert at the start of the pandemic, Philip. It was new to all of us. So I found it strange people going out there claiming to be experts. Yes, if you spend 20 years in gain of function and then released a virus into population, well, I guess you're an expert, self-proclaimed, but 20 years of experience in it. So, yeah. We had the same here in South Africa, Philip.
Well, interesting that you've mentioned South Africa, because I've jumped forward to page 856 in the document, and it mentions here something. Well, it didn't say South Africa per se; it's Southern Africa. So when they looked at this here, this was what date was this? I'm trying to work out what date. August 20th, 2021. Had a conversation with the Minister of Health in Gabon. They were having issues around misinformation and disinformation that led to vaccine hesitancy. They were trying to figure out how they were going to get past this, as they were planning to give out third shots to boost at the same time that Africa had very, very little vaccines. Now, Africa turned out to then, because of the West hoarding all the vaccines, ended up being almost in the best position of everybody and getting natural immunity across their population. There still was loss of life with regards to some people who had comorbidities still died, but they achieved herd immunity, which actually has never been acknowledged.
Yep.
What you hear is that everywhere in the world, COVID is still circulating.
Yeah. Philip, Biologic science hasn't started in the recent past. It's an ongoing process. We've understood biology and seen patterns. Biology is all about patterns, nature. And we've seen these patterns, be it patterns of mutation, patterns of growth, uh, the golden ratio, the Fibonacci sequence. There's a lot of patterns in nature, and those patterns are very well formed and repetitive. Nature doesn't stray from those patterns. So when we see something different in this, like the furin cleavage site, I'd expect that we'd recognize that it's not natural. Now we got 20 years of research in this. It was manipulated. Charles Rixey's testimony shows that all the different manipulations to the SARS-CoV virus was all gain of function, and not one of them could be justified to benefit humanity and understanding of the science. Why would you take a furin cleavage site and attach it to a SARS coronavirus when SARS coronaviruses don't actually have a furin cleavage site? So they wanted to see what the insertion of a furin cleavage site into a SARS-CoV virus, how it will potentiate it. How will it make it even more pathogenic or contagious? And so that's gain of function research, and it had a nefarious agenda. So I think at the end of the day, there might have been a little bit of confusion, Philip, with Fauci not being directly involved in the gain of function work, but having an understanding of the big picture and what's coming. And someone reminded him a little late that the pandemic was pre-planned and he needed to get with the agenda.
Well, he certainly got with the agenda quite completely. And I've got here another section where when they had moved on to boosters and the giving of boosters here, it mentions that there is still ongoing controversy among some people regarding whether the idea about giving a boost was justified by the data. Good conversation with Paul Offit, who feels that we may have jumped the gun. But then Fauci goes on to say the boosters are safe, and to put it in plain terms, it can help and it certainly cannot hurt. So this is how we ended up in the situation, because they weren't sure. And as I said, when I was looking at the data from Israel, my first question was, well, if you have already vaccinated most of this population, and within 6 months you are needing to have a booster dose, that is a red flag to say something is not right.
Yeah.
They didn't take it. Instead, they have gone on to give, what booster dose are we up to now? Is it 12? Could anybody have imagined that in August of 2021?
Yeah, it's Philip. It's there was absolutely. I guess we were not looking at the intention behind the vaccines. It was to vaccinate everyone with as many doses as they could. And if the vaccine was being promulgated as a solution, which it was from the start, then at the end of the day, Philip, we got to look at, did it help? If you look at that one statement at the end, it may help, but it absolutely has no harm. So you're not confident about the benefit, but you're absolutely confident it doesn't have a risk. None of that was tested. These are all play on words and playing with humanity's emotions, making us fearful of things. The way it comes across, Philip, it's a grand manipulation of thought. The words being used. We noticed that the same kind of phrases were parodied over a whole range of different channels. The very same words. So there was an attempt to force people into a kind of mass formation. But like you said, Africa was lucky we didn't get too many of the vaccines. And of course, Africa's got a history of being injured by vaccines with Bill Gates and his cronies doing their nonsense in Africa. So I'd say vaccine hesitancy was already here before COVID came. But if people are hesitant about the vaccine, the way to take away that hesitancy is to provide them with true science. And you convince them of its benefit. You don't blackmail them. You don't take away their freedoms. People are not stupid, Philip. They see the logic. So I couldn't understand why you needed to strong arm people into taking a vaccine that's so effective. I guess by the fourth or fifth booster dose, people realized it was a farce. Philip, when they talk about vaccine efficacy, sometimes we don't need science to prove all that. The first patient that walked into my practice 2 weeks after a vaccination with the COVID infection proved to me the vaccine doesn't work. I didn't need to see 5,000 patients with it failed. Just one patient with the COVID infection 2 weeks after vaccination proves to me the vaccine did nothing for him. I didn't need
Yeah.
to, sometimes randomized clinical trials with big data sets really means nothing. It just takes one to prove a point.
So here's another interesting one. So this is on page 882, and this is now about the FDA authorization and the CDC recommendation, and they were very concerned about Rochelle Walensky, I think it was, and
Yes.
because they're saying we have a serious problem of to how the CDC is going to interpret regulatory approval of the boosters. There is strife within the FDA, which led to this completely confusing authorization. Rochelle has her own problems with the ACIP, who is not going to want to recommend anything for people less than 30 or 40 years old. What a mess. Let us see if in the long run we can make some lemonade out of these lemons. So they were driving this forward younger and younger. And what you can clearly see is that the scientists in these organizations were asking the question, what are you doing? Why would you be targeting people who we knew were at low risk for severe disease? So this is what I'm saying, is that what is coming out when you're reading between the lines is that what they were calling us misinformation for, which was asking exactly the same questions, we were being told we were misinformed. They were not telling us that behind the scenes, the scientific community was saying, actually, this does not make scientific sense. How
I
do
think
we make a lemon? Yeah.
the very similar thing is happening with the war in Iran, Philip. Trump is uh, avoiding his best advisors and doing things according to what he wishes. So when you look at COVID, I look at it, Philip, as a journey. It was a journey to create mass fear, create a false savior in a vaccine, and then it was to forcibly vaccinate the entirety of the planet. Pregnant women and children won't be spared. But we couldn't tell them that from the start. There'd be a revolt. So they had to find a way to justify the vaccines, to hide its ineffectiveness, because I think there's another agenda to the vaccines. It wasn't there to actually stop COVID. We can see clearly it didn't work, yet they're still pushing it. And of course, the side effects were more disastrous than any effect, the beneficial effect. So I think they needed to bring it out in a stepwise manner, slowly spreading the field that they were trying to encompass. So initially, it was sold as a savior. It was given to the older folks. It was pushed in that age group. And then they found, well, they need to get to the next age group. So they found a narrative that would justify that. And by the time we got to little children, they were going to kill their grandparents. And so they needed to take it. So the narrative kept changing, the goalposts kept moving, but the movement of the goalpost was determined by what they were trying to achieve next.
Yeah, I think it's almost frightening to hear you talk sometimes, Shankar. You are so clear in your mind that the agenda was not good. And we sometimes like to think that they were just ill informed, not quite lacking the scientific nous that they needed to make the best decisions. But what you're
Ill-informed
indicating,
expert, Philip.
well, what you're indicating here is that consistently, I am seeing throughout this document that there were scientists behind the scenes who were pushing back. There were scientists who were asking questions,
Yeah.
but they were always overridden. The agenda continued. And the question now that I'm asking myself is, why is it that those people who had concerns remained silent throughout the whole process? Why was it that they were afraid of becoming like a whistleblower? You know, when we think about what happens with this guy with the Iran war and so on, and this guy who resigned, Kent, And he said, listen, I can't continue because I'm concerned about so and so and so. Now, whether you agree with him or disagree with him, the point being is that he had concerns and he raised them and he stood by them. What does it mean when our entire scientific community, and this is not just the US, because in every single country, you must have had those scientists that had questions.
Yeah.
Why did they all remain silent?
Philip, I think it's been coming for years. The medical fraternity is very tightly regulated. And of course, being in that field, dealing with life, some of the regulations are warranted, but there's a lot of fear that goes on with it. Uh, there's a difference, Philip. I mentioned this many times. The West is driven, very, very protocol-driven medicine. The East is more in understanding and trying different things. And we have a broad diversity of functional and integrative approaches in the East to deal with medicine that are not really practiced that widely in the West. And coming from that perspective, Philip, I think at the start of the pandemic, they had an agenda and they knew what they were trying to achieve. And so they had to keep changing things along the way, uh, basically lying to us, Philip, about what's going on. The medical fraternity took their expertise from these so-called experts, and they made them fearful of stepping outside those bounds. When you say, Philip, people didn't want to speak up, if they managed to bully and blackmail the entire planet into taking a vaccine with the threat of losing your job, what do you think those people with the knowledge were going through? I'm sure there was blackmail involved. There was threats of losing your job, and so it's only those people who could bite that bullet and take the job loss stood up, and we saw that around the world. Unfortunately, Philip, a lot of people trying to make the end of the month, and that's all they see.
You know, Shankara, as we close up, I'm gonna say something that just popped into my head. Let's just presume for a moment that you are correct. Okay, we can't say absolutely that you're correct, but you've been pretty accurate so far. Let's just presume you are correct and that there is an agenda that has a specific outcome. Okay. What is very interesting now is that the push is no longer there. Has the target already been achieved with the circulation of the virus, where there are certain places that can never?
Sorry, Philip, your picture froze there for a
Did
while.
you hear that, Shankara?
Just the last bit of your question I didn't get, Philip.
Shankara, have I
Yeah.
lost you temporarily?
Can you hear me? I'm on the screen, Philip.
Yeah, did I freeze or did you freeze?
Yes, you froze the
Yes, it
last
could
bit
have
of the
been.
sentence. It's done again.
Yeah, so what I was saying is that can you hear me now, Shankara?
Yes, I can. I'm just checking my connection
Yeah.
quickly. Yeah, the mic side. Yeah.
Yes. So I think that was my connection. Sorry. So the question is, has the target been achieved? Because there is no longer a major push with regards to COVID vaccines. And so my question is was the target to get populations where we cannot stop the circulation of the virus?
Philip, I think the circulation of the virus is an ongoing concern, but I think that's more a public health strategy that we're going to have to formulate. I don't think they care too much about where the virus will eventually end up, how it will mutate, and how it will cause disease and devastation. But Philip, when we look at has the target been reached, I think the target's being aimed at for a few centuries, Philip. This is not something that came out in the past 20 years. There's a long-term agenda going on. We know about the Illuminati, the Club of Rome.
Oh, wait, don't say anything that will kill this, Shankar.
Yeah.
Don't
But there's
say
a bigger
that.
picture, Philip. There's a bigger picture, and I think we need to be considerate of all the different targets that are in their sights and look at what's transpiring globally with what their agenda actually is. and see if it makes sense there. We know about eugenics and depopulation and all those kind of things, Philip. And so, yeah, we're going to have to look at it in a broad frame to understand what's really going on, not in just this 5 years. This 5 years was a trigger for a whole lot of other things that are coming.
Yeah, so this is the point that I think that we have to leave people with, is that I think that this is so big, so significant, what is happening or what has happened, that if you have a very compliant population, there is no chance to do anything. And so the challenge is to the people who get information, the ones who are listening now, you have to wake up everyone else, because if you don't, you alone can't stop this. And so, what is required is a very coordinated, coherent strategy for everyone to get involved and make people aware of these diaries. Now, the reality is that a lot of people will be upset quietly that it appears that they may have been tricked. Don't focus on that, because it will just let them clam up. What you have to make them aware of is that they need to push to ask more questions about their health, what has happened, what should happen. And these are the kind of answers that, if we don't force them to do now, will never be done. Final thoughts, Shankara?
I think, Philip, critically with what we're seeing with the Fauci's confession, uh, gain of function and biologic research poses one of the greatest threats to humanity that's ever been posed. It's an extinctional kind of development technology. And so, besides the gain of function, I think we need to stop all technology research in the biotech field and start to set some very strict ground rules as to what's allowed and what's not. Philip, this started a long time ago. It's been creeping up very slowly. We know about GMO, and GMO was the start of modification. Uh, I mean, it's one thing to produce white corn or yellow corn because markets like the different color, but it's another thing to start manipulating produce that gives you a completely different, unnatural. If you look around you, Philip, a lot of the fruit you get today are seedless. That means they are sterile. You'll never be able to propagate them. So in the future, who will we be dependent on for our food supply when they've taken away all the seeds? We know that there's seed banks around the world that are being set up to protect that diversity. So the manipulation of nature has come a long way over, I'd say, the past 50 years. And it's that manipulation of nature that needs to be addressed if we're going to actually survive as not necessarily a species, but as a living planet. We have the ability to wipe out all life on this planet just with this kind of technology.
Yeah. So thank you very much, as usual, Shankar. I appreciate the people who are with us. Remember, you have a responsibility to get this word out and to make people aware of what is happening. Thanks again, Shankara, and we look forward to talking to you again in the near future.
Thanks, Philip.